Hello everyone, greetings from Texila American University Zambia. As we all know that annually we do commemorate the World Tuberculosis Day every 24th of March. This date was put in place to raise awareness on tuberculosis disease as well as commemorating the progress made in eliminating the disease.
So, what is tuberculosis? So, tuberculosis is a disease that has been with us for a while. And primarily in layman's language, this disease is going to affect the lungs. It's going to make a patient cough, have night sweats, lose weight that they can't explain, and things like that. But to give you a brief background, in the year 1993, the World Health Organization declared TB as a public health concern. From the time this pandemic was declared a public health concern, various strategies have been put forth in order to combat the spread of the infection. So there's been the DOT strategy. That was the first strategy. Then the second one was a stop TB strategy. All these two strategies never put TB to an end. So we are currently implementing the third strategy, which is the end TB strategy.
Now that we have heard how tuberculosis or TB is transmitted, did you know that there are 3 stages of infection? The first stage being the primary stage of infection or the stage of exposure. This is where small particles containing a few of the TB bacteria are inhaled by an individual, and they travel past the upper respiratory airways and deposit deep within the tissue of the lungs. The second stage is latent infection. The TB bacteria in this stage can generally be found in this region of the lungs. Now, the TB bacteria in an individual in this stage is inactive or asleep. And so an individual generally doesn't have symptoms and may not be ill and cannot spread TB to others. And in the third stage, the TB bacteria overpowers the defenses of the immune system, causing severe signs and symptoms in the individual. And this is known as the active stage.
Risk factors and causes of tuberculosis. If you smoke, or if you're surrounded by people who smoke, if you have diabetes or high blood sugar, meaning you don't do exercise, not like this guy, or if you are immunocompromised, meaning you have HIV or any disease that affects your immune system, you are more prone to getting tuberculosis. Tuberculosis is caused by a bacteria called Mycobacterium tuberculosis, and it is transmitted through air. If someone with tuberculosis coughs like this individual just did, you're more prone to getting this. And symptoms of tuberculosis include productive cough, chest pain, fever, night sweats, and unintentional weight loss.
Diagnosing the tuberculosis disease, we have microscopy and sputum culture. Other diagnostic criteria we can use: lung biopsy, which is basically used when the tuberculosis bacteria is disseminated to other parts of the body, as well as chest x-ray, which is used when the bacteria has necrotized the other parts of the body. For treatment, do not worry because tuberculosis can be cured. How? By antibiotic treatment, which can go for like 6 to 12 months, as well as corticosteroids for that tuberculosis that has gone to the active stage. Preventive measures for tuberculosis. First things first, BCG vaccination, proper ventilation in enclosed spaces, tests all the time, as well as proper etiquette while coughing. Not forgetting the new implemented therapy, which is the tuberculosis preventive therapy. This is basically for the immunocompromised patients where they are administered isoniazid for like 6 months, and it will cover them for like 3 years as they progress in their life. Thank you.
Yes, we can end tuberculosis.